WNYT Albany, News Channel 13, live at noon, begins right now.
At some point, menopause affects every woman, from hot flashes to mood swings. How can you best manage it and still feel good? Dr. Mary Elacqua joins us now with some tips on how to be fabulous at 50. Thank you for being here.
Thank you for having me.
So first, what's the average age that menopause hits a woman?
In the United States, the average age is about 51 and a half, although there are changes that can occur emotionally and physically for years before and years after.
So when we talk about feeling fabulous at 50, I mean, this is the time when all those changes really start to set in for a woman.
Well, they do start to set in, and it's never too early to prepare.
Okay, so what are some ways you can prepare for that?
Well, I think that women need to be proactive about their health. They need to have, especially at 50, annual examinations with their health care provider. And we're talking about well women visits. Don't wait until you don't feel well to see your physician. And those examinations include, especially at 50, a yearly mammogram, blood pressure check, weight check, urine analysis, breast examination, pelvic exam, and then from 50 on, testing such as screening colonoscopy, bone density testing should be done, cholesterol checks, etc. So we're trying to maintain wellness.
For a woman, what are the symptoms that they'll start to notice and they'll start to feel when they hit menopause?
Well, menopause is actually 1 year of no menses. However, as we said, there are changes that can occur. You may have some menstrual irregularities. You may notice some irritability or mood swings, some sleep disturbance, and symptoms vary from woman to woman, and it's very individual.
So how can you work to still feel good while going through this big change in your life?
Well, I think you have to feel comfortable communicating with your healthcare provider to be discussing some of the treatments. However, overall, you should be proactive. Maintain a healthy weight. Exercise, because that helps to alleviate some of the symptoms, irritability, stress-related, and even helps with some of your sleep disturbance. You can discuss hormone replacement therapy. Again, not for every woman, but when appropriate, is very effective in treating some of the symptoms. And there are other medications that are not hormonal that may help with sleep disturbance. We can also look at some of the herbal products and vitamin supplements.
So over-the-counter products?
Over-the-counter products, again, to be discussed with your healthcare provider, because they can have side effects as well.
So the bottom line, you can still feel good once you reach that point in your life. There's no reason for this terrible feeling to set in.
Not at all. And again, communicate with your healthcare providers. Maintain your healthy diet, high fiber. Don't forget lots of water for hydration. And again, when you're outside, your moisturizer with sunblock.
All right, Dr. Mary Elacqua, thank you very much for being here with us.
You're welcome.
And we want to hear from you. If you have a story, idea, questions, or comments, email us. The address is live@noon@wnyt.com.